Hello, 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 and welcome to this very special season of Let's Talk Value. This season is fully dedicated to our latest book written by a set of 5P experts in the field of healthcare change, The Next Tango, a patient guide that also recently became a #1 bestseller on Amazon. This season is also fully sponsored by 5P Healthcare Solutions, a boutique consulting firm dedicated to transforming healthcare through value-based healthcare and multi-party collaboration. I'm Hanna Boëthius. I am co-editor and co-author of The Next Tango and the host of this episode. Today, I am super, super, super delighted to have one of the key people to make The Next Tango happen here with me. This is Sue Robbins. She's an author of the excellent book Ducks in a Row, Healthcare Reimagined. It's also featured in chapter 1. In case you have missed it, pick up your copy today. And more books as well. I'm sure we'll get to those as well. But I just wanted to mention that one little highlight. She's also a speaker and a patient advocate. Welcome, Sue.
Hannah, thank you. Oh my goodness. That's such an enthusiastic welcome. So thank you so much for having me.
Thank you for being here. Well, it's always so exciting to have a fellow patient advocate in the room. And so I'm very excited about our little chat today. But that was
Me
a
too.
very, very short intro. So please do let us know who you are.
Yes, as you said, my name is Sue Robbins. I'm here on the west coast of Canada, so I love that you've got like international representation. I identify, I think, foremost as a caregiver. My youngest son, Aaron, is now 22 years old and he has Down syndrome. So he had many touches with the pediatric health system as he was growing up, and I was very involved in patient and family engagement in children's hospitals over the years. And really, that led me to my career. As you said, I'm an author. I've written 2 books. One is called Bird's Eye View, and it is about my experience as a caregiver and then later as a cancer patient. So I had breast cancer 7 years ago and went through the whole ordeal of treatment and the aftermath. And so Bird's Eye View is both my experience as a caregiver in pediatric healthcare and as an oncology patient. And then Ducks in a Row is more my system book. It's about change. It's about people who are unsatisfied with the status quo. It has a lot in common with your book. I think we talk about the power of patience, the power of engaging people in a meaningful way. And Ducks in a Row, I'm so pleased about it. I really wrote it for health professionals to help encourage them to include patients at all levels of their organization. And I know we're going to talk about that today. So I'm excited about that. I think that's about it. I do a lot of speaking. I believe in storytelling. I've got an English degree, and so the power of patient and also clinician stories is really important to me. So that's me, I think, in a nutshell, pretty much.
In a very, very small nutshell, it's
Yeah,
like
yeah, that's right.
nothing, Sue. It's like you're
Yeah,
just sitting around twiddling your thumbs all day.
yeah. It's so funny when you get these passions, right? And
I
certainly, it's
know.
so funny you talk about patient engagement. Like if we're patients, we're already engaged. Like we are totally engaged because this is our lives, right? It's more than that. So some of us have also made a career out of this. So certainly
Yeah.
it's a part-time endeavor, I have to say. And the patient voice, well, it's something we'll talk about later on, I know, but it's certainly something, an untapped resources, put it that way.
Definitely. And I'm sure we could talk a lot longer than we have time for this recording, just about that topic alone.
Mm-hmm.
But as you are already getting us on the track there, why don't we start with a huge question, but maybe we can, take a few snippets out of our real world experiences. But why does patient engagement matter? And in which situations would you say are the most important?
Yeah, that's the big question, isn't it? And so I wish I had more research to bring up. It's so a bit ironic that we don't have a lot of research about patient engagement and how it affects outcomes because, you know, we don't influence the researchers' questions as much as I wish that we did. So, but I can tell you, if you think about why healthcare, I mean, patients are the reason that stitches everything together. We're the common thread through everything. And really, patients are the thing that all health professionals, anyone who works in healthcare, have in common. And, I really believe that patient engagement matters in all situations to different levels. Like there's different levels of engagement. Um, like I said, us patients are already engaged in, our own bodies, our own treatment, our own healthcare. But really to me, there's two different levels of engagement. There's that point of care, as you talk a lot about in your book, right? Do we have safe environments for us to speak up, to advocate for ourselves when we're in the clinic room with the professional? And then also when decisions are made at the system level, I think it's really important to have the patient perspective, a diverse patient perspective there. And although I felt like we've regressed quite a bit about that since COVID. But I would say, somebody said to me, when we're talking about budgets and stuff, do patients need to be there? And you know what? I would say yes. Like I said, we have skin in the game for sure. So I'd say at all levels, patient representation is important. And of course, we're not necessarily making decisions for staff. I think the key is that we do things together because I really believe in this better together model.
Yeah, it's all about that very important collaboration and seeing, I sound like a cliche, but seeing eye to eye with the people that you work with, some who happen to be patients, some who happen to be your, medical colleagues, some who happen to be researchers, but to have that sort of to seeing where the other person is coming from, realizing that they have a sound and deep and maybe even better understanding of their situation than maybe you as a healthcare professional does. Like those things are so important, and I really, really couldn't agree with you more that is so important to have it throughout a patient journey, throughout a uh, any piece of research that comes out, throughout any product development, making a medicine, through every step. It's so important because in the end, who's going to use whatever you're putting out there?
Right. Yeah. In the end, I think patients are the ones who are accountable. We're the ones, like I say, holding the bag at the end of the day. And so
Yeah.
we should have a say in decisions that are being made. And I know a lot of people, there's a backlash against that because really
Yes.
patient engagement is about, and I'll just be blunt here, giving up power. So people
Mm,
who are in ivory towers, who are used to having all the power and making all decisions, do not want to, that shared decision making model makes them very nervous because I think they know that to me, power is like a pie and it's finite. And so you're going to have to give up a little piece of your pie in order to
yeah.
meaningfully include the patient voice. And there's a lot of people that actually, there are some people that are really doing that and they're pioneers and they're champions. And I really applaud them. But there are a lot of people that are not interested in that at all. So I think that's my biggest struggle as a patient and caregiver in the patient engagement world is convincing people that patient engagement is the right thing to do.
Yeah. That's such a powerful statement, and I think that a lot of more people need to hear it. So I'm very glad that we have it on camera, on the record.
Yay, it's so frustrating. I know I've been
Yeah.
saying the same thing for like over 20 years. My son's
Yeah.
22 now, and it's just like it's very frustrating to me. You think about progress, and I thought that meant things would get better, and things actually haven't gotten better. And so I think of this work that you and I are doing, Hannah's, it's generational. So this is the only way that I can keep going is I'm thinking about planting seeds. So we plant seeds. If you write a book, it's something that can last a long time, which is a wonderful thing. And our messages will move forward. And so I don't really expect to see change in my lifetime. And that's something that's a really hard pill to swallow. But any kind of movement or meaningful change has happened over generations. And so I think it's a long haul, long view that we have to think, okay, maybe one person will, be a little bit kinder to someone in healthcare if they understand the patient story. And that has to be enough of a win for me. But it can be frustrating for sure to keep going. And I think the main thing is we have to have grit and not give up and be together and do this, in community, like you're invited me and you and I have a lot of similar, even though we're at different parts of the world, right? So I
Yeah,
think that, and the main thing is we need to support each other. That's really important.
absolutely. And I think you bring up a wonderfully valid point, and especially if we think about how patient engagement has grown in the past few years. And I really feel like this, what you just mentioned, the community aspect of it has been sort of the fire starter because then you or you as a community inspire others to join or to share their story, or to speak up when something is wrong, or to question, just asking the question why, in certain situations, which can be so powerful. And um, it's so important that that is done, because in the end, we are the ones responsible for our own health, right?
Right. Yeah. Yeah. The group piece of it is, I think that is something I've seen that has grown over the years. Maybe 20 years ago, I pretty much felt like a lone wolf, like the only voice that was speaking up, saying, hey, I think that things could be a little bit better, like as far
Mm,
as how patient and caregivers experience the healthcare system. So I think that we have become more organized, and thankfully, I think because of the internet and virtual and Zoom, and like we've managed to connect together, especially since 2020. It's been a really powerful tool. And see, the folks in power actually don't want that. They want us to stay separate, because if we're separate, we're weaker. But if we're together, we're stronger. So,
yeah,
yeah, anybody who's listening, I'd really encourage you to connect up. You don't have to join an organization necessarily,
no,
but think about connecting up. It's for your own mental health too, and to keep
yes,
your own well-being okay, to have that kind of support with other patients. But it's also, if you're looking at system change, for sure, together we are definitely stronger. And I think that's one of the positive things that's happened over the last 5 years. But there's also been, I've seen a bit of regression since COVID. I think very much a lot of patient driven initiatives got canceled. The folks in power took it as an opportunity to do this command and control and the authoritarian, and then they were in charge again. And I'm not sure we've gone back to pre-COVID that way.
mm,
And so I don't want to be negative, but I have seen things been
yeah.
regress quite a bit. I don't know if you feel the same, Hannah, in your part of the world.
Well, I mean, yes and no. In
Right.
certain individual interactions, absolutely, there is a sign of, yeah, but we have spoken to patients. We don't need to speak more to more patients,
Yeah.
which is
Check, check. Yeah.
mistake number one. But
Right.
then on the other hand, for example, things like the online diabetes community has blossomed since
Mm.
the pandemic, and they/we are stronger than almost ever, and present at every conference, much thanks to people like DDoc and team. But I think there's a bit of it depends on the situation. Yes, it has regressed, and in some of your excellent posts, guys, if you are not following Sue on LinkedIn, you are missing out on everything patient engagement. She's the most active person on the platform regarding these topics, and I think writes such insightful points of view that every day I'm love, love, and I could keep going forever. Um, but it's one of those. I saw in you wrote a post about 10 ways patient engagement goes wrong.
Mm.
And my favorite point of these, I don't remember which number it was, but you trotted patients into the boardroom to sell their sob story and then asked them to leave.
Mm.
Like,
Yeah. That
that's
pretty much
not,
sums it up. Yeah,
yeah,
that's
it's not patient
tokenism. Yeah.
engagement. Yes, tokenism. And
Yeah.
this is something that I have seen a lot, that yes, you may be involved as a patient advocate, as a patient leader, whatever you want to call them. And then you're either asked to leave, or you're not kept updated about what then
Mm.
happens after the interaction, or after the project, or even after the advisory boards that some may or may not be on. And then you never hear from them again. And you're
Right.
like,
That's very common. That I have to say that feedback loop is so important, because otherwise we don't know what the point is. Like, so what was the point of us, if we were trotted into a boardroom, like being, preparing our story, being nervous about sharing our story, making ourselves vulnerable to people, talking about some of the worst moments of our lives, just so it's a it's either a feel good story, it's a sob story, so you can feel better about yourself that you invited a patient. Like, I think I feel like those in power don't understand that we actually want like positive change. We want
yeah,
to actually be involved with decision making and policies that affect us. Like, that's why we do this work. it's not about just some ego exercise sharing our story, because who wants to share their healthcare story? Like I said, it's something that makes us
Time and
very
time again on that.
vulnerable. Yeah, that's right. Repeating the same thing over and over again. And yeah, I have to say that the whole that just infuriates me. Actually,
Mm.
it's using people. So you're using people. So I do workshops about patient storytelling, and when I talk to staff about it and creating safe spaces for patients to come in and share their story, I say, are you using patients for their story? Like, that is the question. Like, we don't want to be used. It feels like a really bad, like, one night stand or something, right? You're used and then you're like actually discarded afterwards. It feels crappy. Like, it feels, and also when, if I talk about my experience with my son, I feel like I've betrayed him in some way
Yeah, of
if
course.
my story isn't actually being used for the better. That's
Yeah.
what I'm interested in. And not everybody really understands that, I think. So yeah, I'm not a big fan of the sob stories. I like that, in Canada, we've, our research money, they're mandated to have patient groups, but just because things are mandated doesn't mean that it's done well either. So yeah, for sure. I could talk about tokenism till the cows come home.
Yes, same here. And this
Yes.
is, I mean, this is such a pain point right now, in the patient advocacy world, and this feeling of just feeling like a checkbox. And they're like, okay,
Right.
good,
Yeah. Yeah.
we're done,
And we
we
know
did it.
that, like, we know that we're aware that that's actually happening, and it does feel awful. And the
Yeah.
other thing is, they often bring out the same, what I would call professional patients, over and
Yes.
over and over again. So I went to a children's health conference when Aaron was younger, and I worked for children's hospitals for about 10 years. And they had the same conversation at every single conference over
Yeah.
10 years. Oh, we need to bring in diversity into the patient voice. They'd always say that. But the problem is, they say, oh, we'll start with what we have. And that those are the patients that are easy to pluck and who are just waiting. And they tend to be like, upper middle class, retired, white ladies. Like, this is what happens in Canada. It's the same voice over and over again. There's not diversity in that voice, but then they never evolve from it. They just stop with that and just keep using the same people because they're easy. And
Yeah.
looking for diversity, I think about the amount of times somebody has asked, can we have a perspective from someone with an intellectual disability, like my son who has
True.
Down
Yeah.
syndrome? And that never happens. Nobody's interested in making the time and creating a space for him to contribute. And that goes for all kinds of diversity too. So, and I worry there's a backlash against EDI now, which is,
Yeah.
happening around the world, and that we're just going to end up with the same voices over and over and over again. I'm not saying people's stories aren't valid, but it's also time for us to pass the microphone to other people as well. Otherwise, there is no evolution. We're just going to remain as a checkbox.
Yeah. Here, here. No, I completely agree with you. This needs to really be diversified. We need to. I love the way how you speak about regular old patients
Yeah, I talk
or
about
good
that a
old
lot.
patients or
Good old
something.
old
Good
patients.
old
Yeah, just
patients.
like regular people. That's what I'm interested in. Like, I read somewhere, and this is very true. Like, if you're doing engagement activities, and there are a lot of professionals that get paid now to do engagement
Yes.
activities, which is bothersome to me as well. It used to be peers that were doing that, like people who actually had the lived
Mm.
experience were in those positions, engaging the people, and it's become very professionalized. And it is people who've got graduate degrees and people that don't necessarily have the lived experience. But that's one part of it. But the other part is the people that you engage should reflect the people in your waiting room. So if you go to your waiting room, say an emergency department, because that's the most easily accessible place generally in healthcare is emergency department, and you see the people sitting there, then your people around the boardroom table should reflect that. It should reflect that. And
Mm.
that takes more time. And that takes things like not just emailing someone and telling them to show up to a meeting. That means having relationships with community groups and going out to
Yes.
the people to do the engaging, not just sitting at your desk expecting people to come to you. And I think that's a part, that outreach part is really missing. And I say engagement work is outreach work. That's what it is. it's actually going to people where they are at their kitchen tables, not expecting you to come to them at your boardroom table. I think that's really important, and you're never going to get any kind of diversity of voice unless you do that.
No, no, absolutely not. Because then I, you know my a bit more about my backstory, and because
Mm.
you've also read the book. But
Hmm.
but I am what you would call a professional patient. I have a degree in my condition. I have 40 years of lived experience. I'm loud and proud about talking about it.
Right.
I
Yeah.
I will open my mouth and share my story every chance I get, as is clear by both books, both Tango books. So I'm not really, and I get that a lot actually. Yeah, but you're not a representative for the. I'm like, yeah, not a normal, normal, you know, off of the street. No, I am very engaged, and I am very um, engaged in patient engagement because I think it's
Mm.
important. But I think we need both parts, and I think we definitely need to save spaces also for anyone from the ER waiting room kind of thing.
Right.
Absolutely. You're
Yeah.
absolutely right.
It's about passing the mic, making
Yeah.
space for others. I often, when I get asked to speak at conferences about patient engagement, I've started doing, I'll do a plenary talk, an opening talk, and then I ask the organizers to arrange a local patient panel. And so associated with that, so I do a general talk about engagement, and then they have local people come, and I've worked with them beforehand, and we've had lots of prep meetings to talk about what's actually going on the ground, because that's not something I can know, especially if I'm coming from out of town, what's actually happening in that
Mm,
particular region. And so the more we can create, and like this podcast, so you're creating a space for other voices to come in and talk. So the more that we can do that, to keep that, makes it sustainable too. So it's not just about the few people who are talking. The more that we can create the space for more diverse voices, I think the better. And I think that's our responsibility, especially if we're leaders in engagement, to do that. So it's not just about ending with us, it's about making that we got our foot in the door, right? We have the privilege to be able to do that because we know how to talk at committee meetings, and we know we're comfortable sitting around boardroom tables and that type of thing, but then encouraging different kinds of engagement. And like I said, it's not always about the boardroom table. It's often about the coffee shops and the kitchen table and going out to meet people where they're at. And the more we can encourage those empowered to do that, I think the better. Then we'll get the regular voice. That's what I'm really looking for, is a more typical patient, not just us, who they feel comfortable with engaging, to be truthful, like, because we are like them. So yeah, the diversity part is really important to me, especially, like I said, I never see, it's been very rare Aaron's been asked for his opinion, and he has
mm.
lots of touches with healthcare, and what he says matters too, like, for
Yeah, of
sure, even
course.
though he doesn't say it in the same way that I do. You just have to, like, slow down and listen a little bit closer. And there's nothing wrong. We could all use some slowing down, that's for sure.
No, absolutely. I couldn't agree more with that. And I think it is also so important, like you say, really meeting people where they are. And unless we start doing that, I mean, I don't point a finger at healthcare professionals or researchers or academia or industry or whatever, but also us.
Mm.
I can definitely personally do a lot more of going out to really find these rare gems that are hiding somewhere that really have good qualitative deep insights that they are ready to share. And I think that is so important as well. And we should
I
definitely
think
encourage that.
it starts with stories, I think. Like, I
Yeah.
would have to say, and not just behind the podium type stories, because again, there's only a certain kind of person that's comfortable with
Yeah.
that, that's interested in doing that, that's able to travel to conferences, that gets asked to travel to conferences. Like, I mean, not all conferences include patients. So, and I still struggle with that, particularly in Canada. I've seen it go very much back to the expert model, all the big conferences in Canada, and maybe they'll have one patient on a breakout panel, and that's it. And like you said, then they consider that representative, right? Like, oh, we invited a patient, and then we check our box. But I'm talking about people really being, their stories being embedded. So, but there's other ways to I think, listen to and learn from patient stories, not just at conferences. So really the one-on-one listening is really important. Like, and it's more than listening, it's listening and learning and then acting on what you've heard. And to me, that's quality improvement, right? Like they talk
Yeah,
so much about quality improvement in healthcare, but it's more than listening. That's important. Understanding is important. That leads to empathy and compassion, which I think is missing in healthcare in
yeah,
many cases. But it's also acting on what you've learned. So being open to people who are different than yourself, that might have different opinions than yourself.
yeah,
And I worry nowadays in our political climate that we're become so polarized that we're drifting away from each other. So I think we can learn and listen from all different points of view. And also people share stories in a different way. Like I said, they don't
yeah,
just lecture. Like some people, maybe they take photographs of their patient experience story. Maybe they make art, like maybe they
yeah,
make music,
exactly.
like thinking about like creative ways to help people share their stories so that health professionals can understand. I think that would make is so much more interesting than somebody just standing and lecturing at a podium, which is actually what I do. So I'm dissing myself there, but I would be interested in hearing other stories, like I said, in different forms, because the more we can include the arts and humanity in healthcare, I think it's
Yeah.
better for us all. Yeah.
I think so too. And I always sometimes I get this question from especially actually healthcare professionals. Well, how do I, how can I listen better? How can I listen in? Where do I find these people? I'm like, you know what? Just join a forum or follow a hashtag or whatever on social media that is related to your patient population and start just looking, just start snooping, see what's out there, see what artwork is being done, see what rage, rap is being made about, some
That's
disease or
good.
another.
Yes. Yeah. Yeah.
Or,
Right.
these frustrating times that people share and so that you can really understand your patient and your patient population better without having to have maybe an uncomfortable situation or uncomfortable um, conversation if you are not ready for that. So just
Right.
follow along or follow a few, key opinion leaders online. Start with that and then, dig
Right.
deeper.
Right.
So I think,
Yeah. That's great
and
advice. Yeah.
yeah, and then also going back to the events, you wrote another awesome thing that I need to quote you on. And you wrote, it's a proper patient-centered event when the cool people are the patients.
Oh yeah, that was actually a diabetes event that I went to.
I saw.
Yeah, it was. So I co-own a health communications company, and one because I'm interested in how we communicate with patients and professionals and plain language and creativity and all that kind of thing. But one of our clients was a young and T1 they're called organization who are people who are under 30 who have been diagnosed with type 1 diabetes. And what was so cool about the event is that I walked up to get my name tag, and I was there just as a supporter more than anything else. And it was an event for researchers and patients. That's what it was
Oh,
for.
cool.
So I didn't fit into any of those categories, but because I wasn't a researcher, they assumed I was a patient. And on the name tag, it was on my chest here. It said, "When were you diagnosed with
Mhm.
type 1 diabetes?" Like people wrote their year of diagnosis
Yeah,
on there, and it was a proud thing that you put
yeah.
on your name tag. And that's what gave you credibility. And I
Mm.
actually felt like kind of like I felt a bit left out because I was like, oh, I was a cancer patient, but I wasn't a diabetes patient. Like it was almost, but I thought it was so great because it really was a collaborative event where the researchers were there with their posters. The patients were up asking them about their research. They were having conversations. There was food there. There was a bar there. Like people were actually just there as human beings interacting with each other. And I just tip my hat, like we need more of those kinds of events where we do things together. It's not just somebody on the podium, people in the audience. And so really to me, it was a creative event. It was kind of fun. Like, aren't we allowed to have a little bit of fun in this work? It's so heavy,
Yes.
most of the time. And so I thought it was super cool. So yeah, I felt left out because I was a patient, but I was like the wrong kind of patient. And the people with diabetes were definitely the cool people in the room. Definitely. So
That is
hats off to
awesome to
you.
hear.
That would include you. Yeah, Hannah, you would have had a great time at the event.
Oh, I would have loved it. I wish I could have, you know, beamed there somehow. But
Yeah,
yeah,
right.
actually, you have it at this event, you had a specific term. It's called type F, type friends
Mm,
and family.
I like that. Oh, and I could have said when I was diagnosed as friends and family too. So yeah, that's
Exactly.
actually I never thought about that before. But yeah, it was actually really interesting. It was a cool concept. So really thinking outside the box a little bit, like and doing things differently
Yeah.
than the way we've done them before. I think that's where real progress and quality improvements going to come from. But if we just keep like Xeroxing, photocopying the same thing over and over again, we're never going to get any traction this way. And I have to say, the physician who got up to speak did some, they had both patients and physicians speaking, but when he got
Yes.
up to speak, he said that their research work was so much better because they had a
Mm.
patient group involved with them. So, yay! Like, I might not have the data around that, but anecdotally, he felt that was very important
Yeah.
part of how it actually changed the way they did research because they had people with lived experience. And I think this is key, helps them craft their question, their research question to begin with, so that they're asking the right questions instead of just including us further down the line or at the very beginning, they often want our name on the grant. I know that happens a lot. They need a patient name on the grant, but actually involving us so that we can help
Mm.
them craft the right research question to begin with is really key. So yeah, there is some, okay, so I said, make sure that I'm not too negative, but you got me all excited about there are some cool events that are actually going on. So I'd say more of that and more of it, us doing it together. I think that's the way of the future.
Yeah. Yes. Yes to everything.
Okay, all
Yes.
right, yay.
No, that's fantastic. Thank you so much, Sue, for sharing your insights, for donating your time to us in our little podcast. And thank you so much for being part of our dream team. We are so proud to have you, and thank you also again so much for your help and
Yay,
your
your book.
insights.
Yes,
And
yes.
oh my God, just seeing my name on a cover or our names on a cover, it's so weird.
Right. Yeah, it's so
But
great. And the book is such a great vehicle for your message going forward. So I think it's a
thank you.
wonderful thing. Yes. So keep going. Let's both keep going.
Yes, absolutely. If we keep going, then we can pull more people along with us. So this
Right.
is how
Yeah.
community works, I guess.
Right. That's right.
Thank you, Sue. Have a fantastic day, and I will see you soon.
Thanks, Hannah.
If you are curious to learn more about how 5P Healthcare Solutions can support you as a neutral broker in your journey to healthcare transformation, please let us know how we can aid in bridging diverse interest among the 5P providers, pharma, patients, payers, and policy.